Go get on the track.
Welcome to Convinced and Confident. My name is Sarah Gilmore, and my co-host is Tamara Bluedorn. And each week we bring to you an inspiring message or person that will help you on your journey to self-discovery. Welcome to our program today. Our guest today is Carl Crooms Jr. The reason I've asked Mr. Crooms to come on with us today is that I've noticed the mental health community has some major concerns about mental health since we've been inside or with the COVID virus. Right, quarantine. Thank you, Tamara, for helping me with that. And there have been some major concerns about those who have substance addiction. So as our guest today, I thought I would include Mr. Crooms. How are you today?
Yes, I'm doing well. Good afternoon. It's definitely a pleasure to be on with both of you young ladies. I truly appreciate the invite.
The pleasure is ours, sir. Let me ask you for a brief moment, tell us a little bit about yourself.
Yes, once again, I am Carl Crooms Jr. I am a licensed clinical addiction specialist here in North Carolina. I've been practicing for about 7 years. My journey began in Florida, where I started doing DWI level 1 and level 2 counseling sessions and assessments there. I have an undergrad from the University of UNC Charlotte in sociology and criminal justice.
Okay.
And I also have a master's from the University of Cincinnati in criminal justice. And I have a master's in professional counseling from the great Seton Hall University.
Oh, Seton Hall. Well, we have one of the best. We can definitely call you a master. Definitely. It's wonderful to have someone like you. But I heard you say that you are an LCAS. What does that actually mean?
That's an addiction counselor at the highest level here in North Carolina. Okay. There's a national level license in substance abuse, which is the MAC. But I practice at the LCAS level, which is sort of like a supervisor. I don't have to have supervision at this point in my career.
So you're at the supervisory level.
Yes, I am.
So that means, let's put it this way, because I know so little about it. What do you actually do? I know you said you practice at the supervision level, but what do you actually do when it comes to clients who have substance addiction?
Well, definitely. The duties include, there's so many. I do screenings to make sure that clients are eligible for treatment. I do, of course, intakes, orientations, explaining the programming to the clients, various assessments, treatment planning.
Okay.
Also individual and group counseling sessions.
Okay.
Crisis intervention, the list goes on. So anything involving the care of anyone who is dealing with a substance addiction, I pretty much perform those duties.
Okay.
Now, I have the question of, I'm sure you probably do youth also in addition with adults.
Unfortunately, I haven't had a lot of experience working with youth with as far as individual counseling or group counseling session with the youth, only because from the age of 12 to 17, most of it's geared towards education and prevention.
Really?
Yes.
Okay. But after 18 and up is when you do, these are the clients that you have most of the time.
Definitely, especially when it comes to assessments. You have a more of a history that you can look at with the 18-year-old as to compared to a 15-year-old. Not to say that 15-year-old haven't been, using marijuana or drinking since the age of 8 and had some dabble
Wow.
with other drugs afterwards. But that is not the norm for this field. So
Okay.
the push is for prevention at that age because their brains still hasn't fully developed.
Oh, yes.
So it's very important to push education at that level.
For that age group.
Yes, ma'am. I've had some experience with educating youth, but as far as actual treatment, that hasn't been my forte yet.
Okay. How is someone referred to you then?
Oh, it's a lot of ways.
Difficult process?
Right. It's several ways. Sometimes you have a family member who is dealing with someone who has an addiction. Sometimes you'll have the courts.
Oh.
There had been a drug possession charge or a DWI or a DUI, which of course the difference is driving under the influence, and then you have driving while impaired. So there's differences there. And then you have jobs. You'll have an employer that has an employee that has a substance abuse problem, and instead of they have to go through their formalities to make sure that employee gets the care that they need. You just can't fire anyone who's struggling with addiction at this point.
True.
I as a registered nurse always was trying to figure out why would someone use, and is there other issues like mental illness or mental health issue or self-esteem issue that we're trying to fix when one uses?
Yes, there are so many different layers to a client that I come in contact with that as a clinician, I have to use a biopsychosocial approach, meaning, there's bio, you look at the breakdown there, it is a brain disease. When you use drugs or alcohol, it alters the functioning of your brain, meaning that the nerve cells in your brain is distorted. So it interrupts the way that we receive, send, and process information when we're under the influence of these drugs. And what happens is our reward system, the part of our brain as far as pleasure, the reward system gets flooded with dopamine, which, then someone, basically their brain becomes hijacked. And when the brain becomes hijacked, when you don't have that substance, you feel like you can't function normally. Well, the brain will start sending signals to your body, and what the result is, you'll start having tremors. You may vomit. You may have low blood pressure. You may be sweating profusely, or you just going through a lot of pains internally because you're dependent of that drug. So yes, that's the bio part, and also there's a genetic portion to that too, because in the fetus, infants are predisposed to whatever the mother puts into her body. So you have children that are born addicted to heroin or methamphetamines, and you see them in the incubators actually going through those tremors, those withdrawals. So there's a genetic portion to that as well. And then psycho, of course, meaning mental health. So if you have some underlying mental health disease, such as anxiety, depression, a bipolar disorder, sometimes that can feed your need to find an escape from those mental health issues. And then the social approach is our environment. Like we were just talking about the youth.
Yes.
The youth, based on what's going on in the neighborhood, sometimes it can influence someone to choose to use, and that's the social approach. Sometimes our families, our environments, or the things associated with drug use, meaning, it could be anything. It could be a show. It could be a music that you listen to, can also influence use. So we, as a clinician, we have to handle things from that perspective. That way we touch on everything that might be involved in the abuse.
Excellent. So you've been involved for several years. Have you found that the abuse or the addiction is more prevalent now than it has been? Is it getting worse instead of better, I guess I should say?
Oh, definitely. It's definitely getting worse.
Why do you think? Why do you think
What-
that? Just kind of off the cuff. What do you think?
One of the things, like we talked about in the beginning, was the pandemic. COVID-19 has definitely made things pretty tough for someone who was already struggling
Yes.
with substance use. And what's happening is people are isolated now.
Correct.
And of course, you have to be because of safety reasons. But isolation can also feed into loneliness. And then when your social activities are cut off, that breeds fear and anxiety. And those two things are kind of like brother and sister to the addiction, So things of that nature. And then also economically, you see the world is changing. People are losing their jobs. They're losing their homes. They're losing their families. So that, of course, is going to cause people to want to escape. So when you're isolated away from AA meetings or NA groups or even Al-Anon, what happens is you may succumb to that addiction that was already there. So I guess the main thing is to make sure that you stick to the principles that have brought you to your recovery. Because if not, if you don't have that support, you can end up relapsing and going right back into that cycle of addiction.
So here I go with the nurse hat.
That's fine.
Yeah, that's absolutely fine.
When they come in for treatment, I know there can be, I'm sure, voluntary and involuntary, commitments to get treatment, that kind of thing.
Yes.
I always have wondered, when they come in, do they recognize there's a problem?
That's a good question.
Can't figure out how to stop, what they need to do in order to stop if they truly want to, or is it after you work with them and done some treatment and some techniques that they recognize, okay, I have an issue?
Right. What happens is, like you had just mentioned, and this is a wonderful question. Sometimes people have an awakening. They decided, hey, my life is, I'm living in insanity and I want to change. So they'll come in and they'll realize that, this is the place they need to be. But we have to constantly reevaluate people to make sure that that motivation to change is still there. So what we do is, as clinicians, we practice gauging them using the 5 stages of change, which, I could probably go on about this, but it's actually the pre-contemplation stage, the contemplation stage, preparation, action, and maintenance. What you do is you just gauge them where they are. You meet the client where they are.
Right.
What you do from there is just help motivate them to the next step. And honestly, we can put everything out on the table for them. But honestly, I always tell the clients that everything is contingent on you. You can have all the money in the world, the great job, the great family, great support. You can have everything around you. And that's what it is. It's support. But if you don't change the problem, which is you, then all those other things around you won't even matter because they'll fall. So that's what we do when they come in. And actually, that was a wonderful question. And we got to constantly reevaluate them to see where they are in those 5 stages of change and continue working with them from there.
Do you see it positively where you've had quite a few who've graduated from the programs never to return? For example, I've heard it said before, once an alcoholic, always an alcoholic, because you're tempted. If you take that next drink, you're in trouble all over again. Is there truth to that?
There is some truth to that. If you are in recovery, you have to make sure that you're able to manage those triggers. And triggers are everywhere. You could turn the television on and it'll be a commercial of CVS, or it could be a commercial on, I don't know, something to deal with alcohol, a beer commercial during a football game. But what you have to do is you have to, like I said earlier, you have to stick to those principles that has guided you to your recovery. Because relapse is inevitable.
Oh,
It's not a
yes.
failure when people
Yes.
relapse. It's just getting back up on your feet when it happens and catching it early, of course.
Okay.
I've
Okay.
had experiences where people have made it through because they were able to, my approach with counseling is my primary approach is cognitive behavioral therapy. So wherever your thoughts are, that's where your decision making is going to go. Because
Oh,
most
yes.
people that are in addiction, they're basically making their decisions off of their emotions and feelings.
Thoughts are
So
things.
right,
Mhm.
exactly.
Yes.
And the outcome is normally to use. But if we change the way they think, of course, that's going to change their feelings and their emotions, and then of course the outcomes are going to be different. So, and then, like you just said about alcoholics saying, "Hey, I'm an alcoholic.
Yes.
I'll always be one."
Yes.
When you change the narrative and say, "I'm a recovering alcoholic," or "I'm a
Okay.
recovering addict,"
Okay.
you walk a little differently in those ranges. And when you attend an AA or NA meeting, you have some members that'll get up and say, "Hey, I'm so and so. I'm a recovering addict, or I'm a recovering alcoholic." The word recovering before that is so powerful and so
Okay.
inspiring. You'll tend to guide yourself along that behavior. But if you constantly saying to yourself, "I'm an alcoholic,
I'm an
I'll always
alcoholic.
be an
Yes.
alcoholic,"
Yes.
then relapse could be a little bit more inevitable than
I
the other.
see.
You can internalize that. So you have to be careful, I
So it
think.
sounds like how you talk to yourself or how you speak to yourself.
Right.
Encourage yourself
Yes.
is what one
Exactly.
has to do. But isn't that difficult because my abuse of the substance has already altered my thinking? That makes it
Mm,
even more difficult, doesn't it?
right. It does. So we
Goodness.
we we do methods such as change talk.
Okay.
We do a lot of things as far as journaling.
Oh,
The more
journaling.
you know, yes, definitely, it's a
Okay.
great coping skill. Also, we kind of stick to the narrative that the more you know about yourself, the better you're going to be in your recovery. Meaning, the more you know about your strengths and your
Mm-hmm.
weaknesses,
Mm-hmm.
the more you can stay on that path to recovery. Because you'll know what strengths you need in that given moment to help you through that obstacle.
So it goes back to self-discovery.
Yes.
Definitely,
Yes,
yes, definitely.
self-discovery.
Are you a counselor?
Well, I think I am some days, but really, that's what our podcast is all about.
Yeah.
To help you on your journey to self-discovery. That's what we talk about, and that was another reason it was so important to have you with us today. Tamara, do you have any more questions? He's an excellent expert on it.
Oh, thank you so much.
This question that comes on the show. So, Mr. Crooms,
Yes.
we would like to know, and our listeners would like to know, is what makes you convinced and confident?
What makes me convinced and confident?
Yes,
Well, I'm gonna tell you some of the things that I've been grounded on
excellent.
ever since I was young. What makes me convinced is first and foremost is I'm a believer. All right, and what makes me confident is I've seen the change, not only in myself but in people. So
Wonderful.
as long as you have a belief, a faith, and breath. As long as you have breath, I believe the possibilities are endless. So that's what makes me convinced and confident.
Excellent.
Confident, convinced. Yes.
Excellent, Mr. Crooms. Do you have any more information you'd like to share with us? You've done a wonderful job. It's been wonderful to have you
Oh,
today because I know so little about substance addiction.
oh no, I really appreciate the invite here. Just a wonderful podcast and
Excellent.
definitely some wonderful hosts. So I definitely
Thank
appreciate
you.
being
And I
here.
know, thank you.
I'm actually on LinkedIn. I have a web page that's being created right now because I
Good.
want to be able to reach out to the entire world. So
Very
uh,
good.
definitely reach me there. My email, everything is on LinkedIn. And of course, I'll connect my web page to my LinkedIn so everyone can have an opportunity to reach out to me if they want to discuss this narrative.
Absolutely. Absolutely. That's what I want our listeners to also be able to contact you. So definitely thank you for that.
Would you like to give that information?
And so you can catch you on LinkedIn at Carl Crooms Jr.
Yes, definitely.
Okay.
Yes.
All right. Well, we thank you for joining us today.
All right. Thank you. Thanks for having me.
Have a wonderful day.
Right. You too. Thank you.
That's our show, and we thank you for listening. If you like our show, Convinced and Confident, please leave us a rating and download us on Apple Podcasts and Google Play.